Glaucoma is sort of an umbrella term for a number of conditions. And the thing they have in common is they all cause a progressive thinning in the nerve or the cable at the back of the eye that we talked about before, which is this nerve right here, comes out back, goes to the brain. And there's different subtypes. The common factor in all of them is it's pressure mediated. So if we go back to that drainage system, the most common type in Australia is primary open angle glaucoma, which is, if you look at this drainage system in profile, where the drainage organ is, basically in most people it should be in like a side view, quite wide open like this, and the drainage happens through the little corner there. So that's open angle glaucoma, and that's because the drainage organ itself fibroses or gets scarred down and is less able to shift fluid in the normal way. And that process is progressive. So it may be a little bit of scarring at the beginning, and then there's more and more, and the capacity to drain outwards reduces. The other type is normal tension glaucoma or normal pressure glaucoma. This is an interesting type of glaucoma because the pressures are technically within the normal range. So usually in the upper limit of normal, somewhere between 15 to 22, but it still causes a glaucoma pattern damage to that patient's eye. And though this condition is a bit mysterious, we know that reducing the pressure still helps. It just means we have to bring the pressure lower for that particular eye. And there are other factors that we think are involved, like oxidative damage. Often it affects the neurons that are more concerned with your central vision because they're more metabolically active, they're doing more work, using more energy, and they're more susceptible to damage in that circumstance. So normal tension glaucoma, it's still an open angle, but the eye is just more susceptible to damage, and it's more susceptible to things like low blood pressure, and other problems that can impair the circulation. Like lots of people who have migraine or who have a condition called Raynaud's, where their circulation's not very good and their hands go blue and cold in the winter. All of those things can contribute a little bit. Finally, there's a type of glaucoma called angle closure glaucoma. This is common in certain ethnicities. The vast majority of angle closure glaucoma in the world is in people of Chinese heritage, but also people of Indian subcontinent heritage. And where we talked about the angles nice and wide with the fluid being allowed to get through the drainage system, it's actually really narrow in angle closure like this. So the fluid has a hard time going around the corner and actually getting to that drainage system. Not only that, with the colored part of the eye, the iris, being in such close contact with the drainage system like this, it rubs off a bit of pigment, and that pigment physically impedes or blocks the drainage over time if it's left narrow for long periods of time. So that, in a nutshell, those are the different types, the main ones. There are many other subtypes, like if you've had surgery or inflammation, or there's certain types where the pigment is sprayed in the eye, but those are the main subtypes.